So nice to see you. Thank you, thank you. Why don't we go to the next slide just to get us into our session. It is time for us to begin the presentation. Again, at the end of the presentation, we're going to do an audience Q&A, and we invite your feedback through the Zoom polls. And with that, I am so pleased to invite Ryan McClinton to introduce themselves.
Good morning, everyone. My apologies for the technical difficulties that we've all encountered here, but we're going to make do with what we can and make sure that we have a very effective time together. As Olivia stated, my name is Ryan McClinton. I am a community organizer by trade, but my full-time position currently is a program manager with Public Health Advocates. I'm a native of Sacramento County, born and raised here, and come from the very proud neighborhood of Valley High, something I wear proudly because it's a neighborhood that cultivated me from the folks that are from that region. As a community organizer, one of my biggest focuses is how do we bring together voices to ensure that the experience of those who are in the room and in the space with us highlight the solutions and the path forward that we're going to do. So again, we're going to spend some time really talking about, next slide, please. Really changing the system with empowered voices. And to do so, we really have four main learning objectives that we're going to focus our time on. Those objectives are identifying how empowered voices best elevate structural gaps in today's systems. Second one is identifying the impacts of community cultural approaches versus status quo approaches, or some of the approaches we know current day. Our third learning objective is understanding the challenges of sustaining community-based strategies. And fourth, but most certainly not least, is understanding what sustainable advocacy looks like. Seen in the chat, folks have hopes of walking away, how to better collaborate and accept and understand with one another on a meta level. Learning more about how you can become an advocate for change. I'm improving our systems. Yes, yes, yes. We're going to talk about all of that. And I want to ensure that as we do so, we're really grounded in some foundational elements. Next slide, please. Also, as Olivia lifted up, towards the back end, we'll have a Q&A session. So if you do have questions that come up, if I'm moving a little too fast, please let me know in the chat. I'll try to slow down some, but I do want to make sure that I hold space to answer any questions that may come up for you as we work through the content here. So the value of empowered voices and systems change. Really what we're looking at addressing here is not only recognizing who those voices are, what empowered voices is, and you're going to hear me use the term empowered voices and marginalized voices a lot. And that's because we're really focused on transformative changes and practices that we're implementing now. But not just recognizing who those voices are, but what makes them an empowered voice and how they can impact the shifts in systems of care that are often connected to types of crisis response and some of the services that we're seeing more elevated in our communities current day. Next slide, please. If you've had an opportunity to join any of CARE's Learning Collaborative sessions, you may be familiar with the graphic that you're seeing on your screen. This graphic really walks through the sequential intercept model, which is a newer strategy that's really looking at how do we best support community residents to either A, avoid the justice system completely, or B, if they do encounter it, how do we best serve their needs so they can cycle out of it instead of recidivizing back into it. The time we're going to spend today is really anchored in that top section, community services, which for me, anytime we're talking about community services and the impact there, that foundational piece has to start with being rooted in anti-racist foundations. And not only anti-racist foundations, but really to do so gives us the opportunity to build culturally competent person-centered lenses. Focusing on that really gives us a chance to make sure that our community residents are developing their individual agency to best address their needs, so they're not really coming into contact with too many systems of care, or ideally, again, the justice system overall. When we spend time intentionally building on those anti-racist principles and acknowledging the historical harms that so many of our communities, our marginalized and empowered communities, have experienced, it gives us the best chance to really live into a care-first model versus a criminalizing the behaviors model that our current justice system has done for, honestly, its entire existence. What this really means is that we're really focused on the unique needs of each individual entering our systems of care, our services of care, and gaining a better understanding of who they are, and what supports would best serve them, and hopefully keep them from entering the justice system entirely. With that intentional focus of understanding each person, we can then connect them to better culturally competent services and relevant services that start addressing their needs and ideally empowering them to make the types of choices that result in better sustainable well-being in healthcare. So all those words really just mean, how do we start looking at really addressing so many of the challenges and the structural gaps that we see from a bottom-up approach instead of a top-down? When we say bottom-up, we're really focusing in on that first layer of contact, the direct client, the frontline staff, the intake staff, and some of those folks who have those most frequent contacts, but often don't really have the voice in the agency to lift up what they've learned in that experience, what they experience, to be some of the solutions that we carry forward. Next slide, please. So I want to bring us back to breaking down this idea of anti-racist foundations and what it looks like. Oftentimes when we're thinking about anti-racism, we're really talking about dismantling structures of white dominant culture or white supremacy culture that's really embedded in so many of our systems of care. When we think about our healthcare systems, our behavioral health systems, our educational systems, our justice systems, there's deep-rooted operational mechanisms that we often operate in that show up and really enforce those white dominant culture pieces that we're talking about. So on your screen, you're seeing here what some structural examples look like, and that's really like the status quo of those systems that I just named. And what are some transformative practices that we can start moving to that start shifting that reality? When we're thinking about either or thinking, for example, we're really looking at when we start defining in terms of clinical definitions what somebody's experiencing, we're limiting the realities that they walk into, right? If we say somebody's walking in with anger management issues or they have behavioral issues, we're limiting what's contributing to that. We're stripping away what the root causes may be that's influencing that symptom that we're seeing. And instead of looking at it with a more complex thinking or a more intersectional lens of understanding, like, well, this is a young Black man who's coming in with some behavioral issues. Is that tied to them just making bad choices and wanting to be that way? Or is it more tied to trauma that they've been encountering and that they're walking in every day at home? Unstable environments, socioeconomic impacts, right, of not having enough food at home or possibly not having stable housing, right? All these things being contributing factors to what we're seeing when they come in the door, and instead of just classifying as a behavioral issue or a depression or some severe diagnosis, we're now starting to look deeper at, okay, what's the holistic experience of this person and where can we really acknowledge those things, right? That's that transformative practice that we're trying to shift to. When we talk about power hoarding and we look at the systems that we operate in, right? Power hoarding is really looking at that frontline staff level of, if we have intake staff, if we have social workers that are experiencing complaints from clients, recognize the frustrations that people come in where they spent 4 hours waiting in line after an hour and a half traveling to the location where they're trying to receive these services. What's the information that they could share back with us to let us know how we can improve that, right? Power hoarding looks like, okay, well, I heard your complaint and it happens that way because this is the way that we're going to do this, right? Your opinion matters less in us solving this problem versus actually looking at what you can inform us of where we can actually address so many of those gaps, right? Power sharing looks like, hey, let's bring in that frontline staff. Let's bring in that middle management or those program managers who often field those complaints and ask them, okay, what are you seeing that we're not doing that we might be able to improve our systems on? Or where are the things that we need that we might not be able to do directly within our department or within our system, but if we had improvements on our electronic records management or some of those different things that we can really address to start changing it, and not just taking their information and saying, we're going to do it and we'll come back and let you know how it worked out. No, it's walking with them each step of the way to ensure that their input is being valued, heard, and implemented in that process, right? That's how we start, again, moving to that transformative experience and transformative practice. That's where we start really instilling equity, right? And last but not least, even when we look at transactional goals, right? So many of the metrics that we look at of effectiveness and evidence-based practices are rooted in numbers, in quantifiable data. But that oftentimes leaves out the qualitative data, where what's the experience of somebody, right? If we're asking a social worker, are you seeing 20 clients a week, right? Which I know that may be a high number, right? But if we're asking somebody, we want you to have 10 to 20 clients that you're seeing a week, to make sure that we're hitting our numbers, that we're seeing as many patients as possible. Is that really the right metrics that we need to look at versus if we're seeing 5 to 10 clients a week, are they having the type of transformative experience with you, the quality experience that doesn't bring them back into our doors, but we're instead arming them with the tools and the resources they need to better sustain themselves and ideally not be so reliant on our services, but start really building their self-efficacy and agency to take care of those needs, right? So how do we shift from some of those transactional, number-based goals to start moving to more transformative goals and qualitative goals, right? That really improve the enhanced experience, right? What we're impacting in this foundation of anti-racist foundations, this is where we start building in equity. This is where we start building in a racially and culturally competent understanding of what the experience is of folks that we're walking through our systems to ensure that they're best, that our system is best showing up for them and meeting the need. Next slide, please. So as we're recognizing what that experience looks like and what that process is, we're thinking about who we're talking to, right? Who are those marginalized voices that we're starting to empower, right? And again, we want to start from the antithesis point, right? We want to start from the very beginning, which is the client, the person who's coming in the door with a need. What is their experience? And it's more than just asking for a quality assurance feedback survey or asking us to tell us like, how was your experience today? But it's really sitting down with them in intentional time to unpack their experience, right? Where does their emotion come up in certain things that they're talking about great frustration versus saying, I really didn't like how I had to wait 4 hours at the start of the line, right? It was really when I got to the front desk that there was a representative who was really rude with me. And I couldn't understand why they're being rude with me when I didn't do anything to them. But we're also recognizing that they're telling the story of somebody who's stressed out on the other end, that we might have an impact on how they're experiencing, right? And that's that intake staff. What's the experience of the intake staff that can share with you, here's why I might be frustrated navigating some of the things, because the questions I'm being asked, I can't give them answers to, or I have an answer, but because of our process, I'm not allowed to provide that resource to them, right? Really, again, unpacking what the experience is from those folks who are on the front line and directly experiencing them to better learn where can we improve our systems delivery and where can we improve our practices to make those better meet the needs of our clients and our staff that's serving our clients, right? Again, some of those other empowered voices can be social workers and folks who have the most frequent touch points with those who are experiencing the burden of all the decisions that are being made. And sometimes the systemic failures that come up as we're navigating these systems, right? So many times a social worker can tell you that, hey, these are the services they need, but we don't have a direct connection that we can pass off to, right? Not always the case. You know, sometimes there are MBT teams or multidisciplinary teams where some of that communication is shared, but there still may be a glitch in the process that doesn't allow the smoothest transition or the warmest handoff to occur that makes it easier for the client, right? All of these perspectives are perspectives that you'll want to bring in and not only unpack what the experience is, but really co-produce with them what are the solutions that we can do, right? And start answering those questions. And again, that's why they're so valuable, right? Because there's this reality where we talk about lived experience, and I'm so glad that we're in a space where we're starting to value lived experience so much more. And what's tied to that lived experience is relevant experience, right? It's something that we know is there, it's cooked in there, but we don't often acknowledge the power of that, and that relevant experience really fleshing out what's the gaps in our processes that we can really improve, right? So all of this really to say, when we're thinking about the who, our frontline staff, our residents who are directly impacted, some of our middle management and some of our direct service providers, who are those voices that we want to make sure that we're impacting their experience to best learn what can we improve and what's that process to improving, right? When we do that, we start then identifying a strategy that we can move forward with, something that we can build on, to start really shifting the ways that we've done things in the past to get to more of an equitable space that's really having a transformative experience. Next slide, please. Which then brings us to the question of what does strategy look like in action, right? After we've identified these solutions that we want to implement, how do we then implement them and really put them into a space where they can move forward? Oftentimes what we're hearing in these solutions are things that are innovative or different from how we've done things, right? Which there's a tension that we want to hold on to, like, yeah, that sounds good, but we really don't do things that way. Well, maybe we need to stop doing things that way and start shifting to what they're saying, right? If we're looking at those non-traditional pathways, now we're talking about a need for deeper advocacy, because oftentimes there's a regulatory force that's telling us, hey, this is why we have this process in place. So if we're being told that by regulation, we have to track these metrics and we have to show these steps being followed in order to access this service, well, now we need to start addressing what questions or who do we need to talk to change some of those regulations that now improve the impact of the person who brought us the challenges that we're seeing on the front end, right? Sometimes this means that we're going to start looking at not only addressing the regulations, but what funding is needed to support those regulations being shifted, and even more so to support the people who are going to deliver those services, right? So we're going to talk a little bit about a story I want to share with you all in Sacramento County, how we moved into that process. Next slide, please. So in Sacramento County, and I'll try to be brief as possible with this story, we have a service, Mental Health Services Act, which many of you are familiar with, that's designed to really meet the need of underserved communities and marginalized communities for the mental health needs from a preventative, early intervention, and innovation lens, as well as some of the more severe needs for mental health services to really deeply penetrate those populations that are stigmatized most and underserved most, right? About 4 or 5 years back now, it feels like, I believe it was 2018, right? A great friend of mine, Kendra Montgomery Block, shout out to Kendra, who was formerly with the Sierra Health Foundation, reached out to me as she was a member of the steering committee for the Mental Health Services Act and said, hey, bro, if you can get to this meeting, we're having a public hearing on what the budget's going to be for the next 3 years funding. And there's a lot of things that are not being said. And I need you to bring those voices here so we can start addressing that. What that translated was, Ryan, I know you work with a lot of frontline staff doing crisis intervention, gun violence reduction. When I say crisis intervention, I mean violence intervention as well, right? And directly connecting with families who are highly traumatized but don't have a lot of resources that actually meet their needs. So who are those voices you could bring with you to this meeting and listen to what's being said and then share back what those challenges are, right? Using that civic engagement process of public comment to share, hey, there might be some more questions that you need to answer. And that's exactly what happened. As we were hearing this 3-year plan, I heard nothing about African-Americans being mentioned, nothing about our youth needs that are happening on our campuses, nothing about the deep traumas that our communities are experiencing. And at this time in Sacramento was the height of gun violence, that all had massive needs that were being unmet. And the bigger reason why this was a concern is because they were saying that there was about $43 million of unspent funds that were going back to the state that could have a huge impact on our communities. That made us go up in arms. That means those frontline empowered voices, right? Those clients that are being delivered, those service providers that are coming in are now sharing, hey, we have a challenge where our schools don't have counselors on campus that can meet the needs of our students of color. Our parents are walking in trauma of their own, trying to provide for kids who are experiencing trauma because of our socioeconomic status that they're going into schools and underperforming with. We all need help, but the traditional systems that you have aren't meeting our needs, right? That alarm set off a shockwave that allowed that body, so these empowered voices, again, starting to connect with decision makers of that steering committee to say, hey, we actually want to get answers to these questions. We don't want this community to leave this room being unheard, right? And credit to the county, which talks about some of that partnership that we're looking for, to say, hey, you know what, we heard that call out, and we now want to build a process that we can really start addressing this need. So behavioral health, partner with myself and a number of other community advocates to make an ad hoc committee to really start unpacking what's the realities in these communities that are hardest hit by so much trauma, but least served, right? And we held a series of learning sessions that I'll try to make even quicker to say that let's hear what the community's actual needs are and what are some of the solutions they like to see more of. So what you're seeing on your screen here is a result of that, right? The county, through that process, developed an African-American trauma-informed wellness program that really worked as a funding umbrella to provide a bunch of smaller organizations that are already doing work in our communities better capacity and bandwidth to serve a greater population of their community, right? One that's highlighted that I want to share a spotlight on is Hooked on Fishing, that was led by a gentleman by the name of Mr. Tim Poole, a brother of mine that I have so much love for, because this is a person who out of his own pocket, out of his own time, recognized that there were students who were deeply in need, that had social, emotional challenges that weren't being met and that they weren't being heard, and said, you know what, I'm going to create space and hold it for them and give them a space to slow down and process what's going on. So he took a group of youth out on a fishing boat that he had from a couple friends of his, and showed them how to fish. And walking through that physical process slowed everything down that was going on in their lives, and held safe space to start building relationship and rapport to unpack what's going on with you. Why are you having these outbursts at school? Why are you having challenges with your mom? What are you experiencing? And this isn't for me to go back and tell on you and say, he needs to do this, dot, 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 dot. No, this is to really give space to really understand what are you experiencing and having that emotional space to share. Given some of that, it really gave the young folks an opportunity to start articulating what their experiences is. So when they go back home, when they go back to school, they can say, you know what, Mr. Smith, my teacher, my counselor, my principal, my emotions that you saw are really a result of me feeling stressed and overwhelmed because I'm not really getting a lot of sleep at home. We've had to move around a little bit, and I don't want to share too much of that because, you know, whatever the case is, but really start unpacking what their needs are so they can be better responded to, versus being quiet, closed off, and reserved, or acting out as we've seen before. So many of these programs like Hooked on Fishing and Improve Your Tomorrow, which really focuses a mentoring program, really starts addressing the needs of our young folks and giving them in a space that they feel comfortable sharing, but is also culturally relevant to them. But the bigger part that you see within this list isn't that it's just focused on kids, it's focused on the whole family unit. So when you think about On Track and Roberts Family Development Center, or RFDC, or Rose Family Foundation, these are programs that not only focus on the youth, but the entire family unit, and seeing what's the needs, the mental health needs and the supportive needs for the parents. What economic needs do they need support on, like housing or food security, or some of those things can better help them show up for themselves and for their families, right? And now we're starting to do things in a non-traditional way, but that's really having a real impact on the community that's most marginalized and often underserved. This strategy that moved forward really gave space and credence to so much of our communities that oftentimes don't have an opportunity to provide these services because they don't have the funding to do it or the staffing levels to do it, to really show up in a different way. So I just really want to give you that real-time example of what some of this advocacy looks like and how it can come to be put in action. Next slide, please. But yeah, you're absolutely right? As we're seeing some of those results come in, sustained programmatic funding and barriers to service delivery are the two biggest ones, right? And some of those barriers really come from, again, who's providing the funds. So many of our nonprofits are operating on limited grant fundings that cycle out after 2 years, right? And they have to go out and hunt for more funds to continue delivering the services they have. But when we go back to, again, that part of anti-racist foundations, those grants are often written in qualitative data metrics that then prove the evidence that these are successful, right? That say you're meeting enough clients, but we also need other metrics now that can further prove that your program is being successful. And that limits the ability for that direct service provider to actually provide those services, because now they're focused more on meeting metrics that fit a specific service delivery model that doesn't match the service delivery model that they're actually executing, right? Again, qualitative versus quantitative, or quantitative versus qualitative. My apologies for my verbiage here. I want to make sure that we're getting all this information in. We'll move to the next slide, please. There's an opportunity for you all to see the polling results that came in. So when we start really unpacking what these experiences are, I'd love to share a quote from you from one of the service providers that I mentioned before at Rose Family Foundation. One of our biggest challenges is that we have to fight for pennies to sustain the staffing levels needed to manage our current caseload, much less the cases we need to serve but can't, right? And again, Rose Family Foundation is a foundation or a service provider that not only meets needs for providing youth mentorship and programming on that level, but also helping with rental assistance, food vouchers, and some of those pieces, right? And they have a pretty large caseload, but the reality is they don't have the staff to be able to continue serving that need. So again, where's that funding supposed to come from? Oftentimes what these programs are doing are meeting the needs of our public sector, city, county, state level programs that once were funded and once had a department for them that also had a price tag that included pensions and some of those things that are now massive savings. Why are they massive savings? Because they're being paid for in one-time funding. But if there's that much savings being generated, why aren't we driving more funds to support those programs? We'll skip through 2 slides because I want to get to a couple slides to get down to sustainable advocacy. Absolutely, Cindy. That is very true. The penny pinching and holding services also creates a scarcity mentality that makes it very hard for our community-based organizations to move forward in. Could we go to slide 14, please? Oh, one more. There we go. So when we're starting to think about what sustainable advocacy looks like, and I'm gonna move through these slides pretty quickly because I still want to have time to answer a couple questions. Again, we're identifying where are the ways that we can sustain the funding for these programs and creative ways that we can look at them, right? So often when a community-based organization comes up with an idea, the first place people go is that it has to come from our general fund of our city, county, or what have you, right? But oftentimes there's some areas where we can pull funding from that helps sustain that, like we talked about with the MHSA, right? That's not a traditional funding pot that a lot of folks look towards if you're not in that sector, right? But that's where we want to kind of identify. Next slide, please. So a quick example of where sustainable advocacy looks like or what that funding looks like. In the case of the African American Trauma-Informed Wellness Program, initially MHSA said, hey, we have $600,000 in PEI dollars that we can actually give annually to this program. Let me say that again, $600,000 for the county of Sacramento's Black population. That's not nearly enough. Granted, advocates came back and pushed to have that number increase to 900,000, but still severely underserving the need. But the positive side that we can build on is that these are sustained dollars, right? These are now general ledger dollars that we can start lifting up to say, hey, here's the impact it's having with this minimal funding. What happens when we robustly increase that funding across the board, right? So we got to build on those things that are working. At the city level, that looked like us advocating for more community response in the city of Sacramento, in light of some of the gun violence that we saw and some of the issues that we see around our homelessness team, and the sustained advocacy to our city council. The mayor offered up creating a Department of Community Response to the tune of $5 million annually that goes to their budget, right? This is pass-through money that's available to community-based organizations. So again, we're starting to build that muscle around what that sustainable advocacy looks like with public sector dollars. And last but not least, on top of what we push for the MHSA funding for African American Wellness Program, we advocated to the county to have a larger pot for mobile crisis response that's not rooted with law enforcement. Again, dismantling those white dominant cultures and those systemic white supremacy functions of how we address community safety and needs, and putting them more so into a more responsive and culturally inclusive program, like an alternative to 911 wellness crisis call center response team. That's what the WCCRT stands for, which we're currently renaming, to really be put in place, and $11 million per year allocation to start developing that program being in there. So what we're talking about is advocating on multiple levels with those sustained voices, those empowered voices, to really lift up the solutions that are needed, but co-producing those with some of our stakeholders, our department leads and whatnot, right? We'll close out on this last slide. Next slide, please. Really thinking about the 3 keys to sustainable advocacy. We want our advocacy to be community-led. Community groups, organizations, and advocacy voices that are asked to vulnerably share their experiences and ideas for change needs to continue to be compensated leaders in the development and implementation and oversight of those ideas and sustainable solutions. Really, where we ask community to come in and be a part of the process, we can't tokenize their experience, right? These are communities that are often on the lower end of the socioeconomic pole and need to have sustained funding or sustained compensation for their time that they're committing to improving a process where a lot of money is already being poured into. We need these programs to be department supported. If we're ever talking about public sector dollars, there has to be a department that's going to house that budget and write it into each annual cycle's budget to move it forward. So who's that department, county, city level department that's really going to work with community-based organizations to ensure the funds are there to continue building, right? And it's a co-production model. Nothing about us without us. If you're not there, if those voices who brought it up aren't there to implement it and then also ensure that it's being executed, we're doing it wrong. And lastly, that hits the third point of inclusive implementation. Again, I want to stress the statement, I know you've heard it before, nothing about us without us. Do not bring these voices in and tokenize them. Do not allow them to be the person who's sharing a very vulnerable and often traumatic experience and not really being given agency and the ability to ensure that this program is met, and often the upward mobility to not only bring themselves in, but also bring in other community members who also have an impact on making sure these services are well equipped and performing to the level that the community needs and expects. I know I exposing a lot of information there, but I do want to hold some time for this last slide to really open up the floor for any questions that folks may have.
Thanks for the reminder of the nothing about us without us. I tried to tell others that no one is trying to be rescued, but empowered.
Yes, indeed. Such an important factor. Again, when we have agency to really lead for our own needs and our own requests, we have so much more ability to really make sure all those needs are met, and even build on other opportunities for others as well. We have to make sure that those keys are always at the forefront of it, right? Make sure our community is present, make sure that they have partnership and co-production, but also making sure that they're part of the process the entire way through.
I think the point about empowered voices is it's such a good heading.
Yeah, it really opens up, because what's missing that lived experience component is that there's so many things that we're drawing wisdom from and experience from that can really inform a process to be better, that we're able to tie in when we bring in that whole person experience versus just the aspect of the token aspect that we're looking at somebody through that limited lens. So empowering those voices to show up in full really opens up so many more doors. And literally, I'm only here because I was one of those empowered voices. I had an organizer who said, Ryan, you got something to say. You've seen a lot through your communities. You've lived through trauma with your own direct family's mental health issues, and you've seen what criminalization can do to a community. So share that out.
How do you empower minoritized or marginalized voices, right? And there, Rose, I see just put in, do you have any suggestions for increasing outreach to BIPOC or IEP communities?
Yes, indeed. The primary strategy will always be bring in the voice and empower them to share what the experiences or what the challenges is of connecting with the community, right? So in one of the spaces where we do a lot of crisis response work and really looking at what does safety mean for so many of our marginalized communities. Some of my brothers and sisters from HIP, that's Hmong Innovating Politics, if I'm correct, if I'm saying it correctly, really share that for so many of the population that they serve, that's English as a second language, when they're calling into law enforcement saying, hey, I just experienced a hate crime, oftentimes they're being denied the service and care that they do because law enforcement doesn't define a hate crime to the way that they just experienced it, right? So now who are those voices? Who's that person? And it might not be the person who was directly traumatized, but it might be a family friend or somebody that they trusted to share that experience that can come in and say, hey, look, when law enforcement's coming in, they're not addressing this the right way. And also, if you want to see us come into this space, here's what it needs to feel like. And taking that input to then start doing better outreach, right? And not just one voice. Again, no culture is a monolith. There's so many experiences that we have within our cultural diasporas that we want to make sure we bring in as many of those voices on the front end and start planning and including what's effective for your community and letting them or empowering them to lead the way so we can make sure that that outreach happens and is effective to the folks that we're reaching out with. Do not do the tone deaf thing of putting somebody who says, hey, I have a Black friend, or I have an Asian friend, or I know what this is like. Don't let that person be the person to lead that charge. Please don't. If they have those friends, bring those friends in.
Thank you so much, Ryan. And thank you all for joining this session. Ryan, I again just want to make sure that we thank you very much. And Ryan, I see that you also have a response. Do you want to just end with that response before we head out of here?
Just raise the importance of wanting to lift up some of those impacted voices and lived experience voices, but not tokenizing their experience. So much of what helps us do that is really when we start with how are we caring for the person as they walk through the door. If it's formerly incarcerated, like she lifted up in that example, we want to make sure that we know they walk in with often large amounts of trauma. So off the bat, how are we supporting them with making sure that they have resources for mental health, therapy, counseling to process some of that trauma, but also leaning into what are their other needs that they have? Do they have financial needs that we might help with compensation? Addressing those needs allow them to show up more vulnerably and also recognizing that they're cared for and centered in. So now they can even show up more consistently as well versus having to split their hairs of where can I be at with multiple times because I don't have the capacity and bandwidth in my daily lived experience to really do so. In the chat, I also dropped my emails. There's my personal email, my business email. If you'd like to follow up and have any more dialogue, I really want to be a resource to you all so we can unpack all of that. Please feel free to reach out to me. I'd be honored to speak with you. Talia, again, same to you, sis. If there's anything I can do to support you in the work that you're doing, by all means, feel free to reach out. And last but not least, I really want to give major appreciation to CARES for holding this space and holding this conference and giving us a space to really unpack so many of these challenges that we see in our daily work and the work that we want to do, but really having an opportunity to share and strategize together to build on it. Thank you for this opportunity so much.
Thank you, everybody. Thank you.